Everything just started getting bigger. My arms got bigger. And the pain is just
Gone through the roof.
the pain every day.
Yeah.
It's the worst.
Yeah. It robs the joy of the day from you every day. I'm sorry. You can let her rip here. This is a safe place. We're here to help you out.
My husband, I can't even. We just got married last year.
Oh, congratulations. Thank you.
And I haven't been able to do anything because of my leg shirt.
Yeah. Well, let's start working on that.
Okay. I'm willing to. It even started. My leg started creasing.
Yep. Yeah.
Even when the sizes are really bad.
Yeah. So there's a lot of things that can spur on this to get worse. It can be, obviously you're born with it. It's genetic.
I believe my mother had it.
Yeah.
I really do.
1 in 4 women have this. So lipedema, also known as painful fat syndrome, is a mixture of 2 genes that get turned on.
Do you mind if I record your voice?
Sure, go ahead.
I just want. Oh, you already started.
Yeah.
I was gonna ask you. Sorry.
So it's 2 genes that get turned on. So you have a pro-elasticity gene and a pro-inflammatory gene. The problem is that we don't exactly know why. We don't know how it truly is expressed. There's some research going on in this, but it's tough to find people that are knowledgeable in it.
Yeah.
And the other thing is that I don't know what causes kind of the truncal obesity, because this stuff in here is usually separate from this stuff
Right.
in here, which you're telling me is what you've experienced.
Yes, because not until recently my belly started getting a little bigger.
Yeah.
But I believe that has a lot to do with not being able to walk.
Yep, I would agree.
It's making my MS worse.
Yep. So we've got a lot of stuff that we need to kind of help you out with, and what we need is basically a team in your corner to help you through this. So that you're, 1, don't feel alone, and 2, feel as though people are paying attention and starting to take an interest in helping you. But you can't do that sometimes without a diagnosis.
Right.
So I'm glad you came. We'll help you out with all that.
Thank you.
So I never want to overpromise and underdeliver.
Right.
Okay, we got a lot going on. I think there's a lot of different parts, and we're going to slowly try to make improvements in everything. I'm not an expert with the MS or other issues. You got a list of things.
Yes.
Your list of diagnoses is
Yeah,
really
she's
long.
had other doctors say,
Right.
you're too
I'm too
complicated for me.
complicated.
No, I don't think you're too complicated. It's just that there are complications that we're going to have to keep in mind, that if we want to pursue certain things, we're going to have to jump through the hoops that we need to get other people on board to help. Does that make sense?
Yes.
Yeah.
Okay. So I'm going to ask a few questions about your overall health, and then we're going to talk and put a plan together just for you, and start small and work and get bigger.
Okay.
So, but anyway, going back to the kind of truncal obesity that you have, I don't know if it's because of change in metabolism, hormones, lack of moving,
Well,
depression,
Mhm.
anxiety, all that contributes. I don't think it's just one thing.
I have PCOS, endometriosis,
Right.
and adenomyosis.
Right, there you go. So all that together is going to contribute to that. And certainly that contributes to some of the extremity stuff, because we know people who are overweight do get some extremity stuff. But your extremity stuff, and with the pictures you're showing me, certainly is the lipedema.
Okay.
And so, in fact, I was going to, I told my nurse before I walked in, I said, I bet you she has lipedema because I read your chart of the painful extremities and fibromyalgia diagnosis and the chronic leg swelling, and you're so young.
Yeah.
So,
And my hands have never really been big
you
like
have
I've
the typical
seen.
cuffing. That's it.
My ankles and everything.
Yep. And you're getting a little bit of the lymphatic component now, but that's more so, I think, because of weight and inflammation, rather than that this is lymphedema primary. Does that make sense?
Yes.
Now, if we need to, for insurance and everything, because all this is genetic, and you can have lipo, meaning the lipedema, and lymphedema together, we're still going to do what needs to be done to get you all this stuff for insurance and that kind of thing. So that's a mindset difference. So forgive me if I'm all over the map.
Oh,
There's
no,
just so
you're
much going
fine,
through my
you're fine.
brain right now of wanting what I want to do to help you out. So, a couple questions. Shortness of breath, chest pain. Any concern with congestive heart or pulmonary dysfunction?
No, not with the heart, but I do now that I'm always in so much pain. I get really short of breath
Sure.
just going to the bathroom.
Sure. And that's also because you've probably over time been deconditioning because you haven't been able to be as active. So we'll keep that in mind. All right. And then as far as sleeping, do you sleep in a bed, sleep in a chair?
She wished she could sleep on a bed, but the way she had to sleep right now is on the
It
couch.
hurts.
And that's even hurting her bad at night time too, because she can't sleep in one position.
Got it.
All
Because it
my
hurts so much
life.
here. Yeah.
All my life I've slept on my sides. What, about 2 years ago I stopped being able to?
Mm-hmm. Yeah, she's been in
And
there.
I've slept on a stupid couch.
Okay. So you're on the couch, but you are able to get the legs up?
I put them on, we have like one of those couches with the L shape.
Sure. Got
And
it.
I put my legs on the L part
Sure.
and
got it.
have
So you're
like
a
my
sectional
footstool
kind of thing.
beside me.
Yep,
Yes.
perfect. Okay. So you are equalizing the pressures.
Yes.
Okay. Because some people, if they're short of breath or because of body and everything else.
But I can
you know,
tell that even that's getting to where I'm gonna have to literally sit up to sleep because I'm not peeing as much as I used to get all of it out.
Right. That's probably because of the increased inflammation and you're starting to retain a little bit of the fluid in your extremities like lymphedema does. So we can help fix that too.
Okay, good.
And then as far as liver kidney function, never any issues there?
No.
I know you've had auto-inflammatory kind of checkups and
Yeah,
things,
they did find some early stages of sclerosis of the liver.
Yeah, but that's typical for,
Yeah.
I mean, that's an American thing, you know, hepatic steatosis, and we all get that. All right, so let's go through then what I'm thinking is as far as what we need to do. Where do you live?
I live in Pine Tops, North Carolina, which is about an hour from here.
Okay. What's your transportation like?
As long as my father doesn't have anything available, he'll bring me.
Okay. And,
And last time I had an appointment with you and you were sick, and I'm
Yeah, I'm
sorry
sorry.
you were sick.
Yeah,
I
I had to
actually
move it
got
all.
a hotel room and I rented a car,
oh,
so
I'm so sorry.
it's alright.
No, it's
I
not.
was
I'm
very
sorry.
disappointed.
I bet you were. I'm so sorry.
No, you're fine.
Yeah, I had a fever and chills, and
Oh my
I couldn't
goodness. I'm
come
so
in.
glad you're
I didn't
better.
have COVID, but it was a bad virus, and I just couldn't come in.
But yes, the transportation right now, knowing that my dad's out of work till August, is fine.
Okay. So, the first thing we're going to need to do is we're going to need to get you a physical therapist. The physical therapist is going to do three things for you.
Okay.
One, she is going to help you with strength training, range of motion, getting up and moving around,
Okay.
because we got to get you active and we
Yeah.
got to improve the overall deconditioning. The second thing she's going to do is she's going to help you with compression.
Okay.
And there are different compression garments that we can get you, or wraps or things of that nature.
I do have my own leg pumps.
Perfect.
I
And
have
the
the
machine.
machine. I have
Okay,
the
do you
machine
know
and the.
what's the name of it? Is it Tactile or is it BioTab?
Didn't you take a picture of it in your phone here a while back?
No.
That's okay.
It's a big box
Yes,
and it has the little dial.
Yeah. Does it go all the way up through your belly, or does it stop?
No,
just
it
north?
comes up to here.
Okay.
And it's like
It's a
not
zipper.
it zips and then it buckles.
Yep. Okay. So I think that's great. I'm sure that helps out a little bit of the tenderness, get some of the fluid out. How many inner tubes does it have? Like 3 or 4 that fill up?
Yes.
Okay, so it's a basic device. All right. I think what we could do is we can upgrade you to something that would actually help your legs feel better, and we could probably even get you something for your arms.
Wow.
Yes, 'cause
Okay.
Yes, that would help her
Yeah,
out a lot.
that's because the nice thing about those devices, not only does it move fluid, but it also helps out with that hypersensitivity. Because one of the things we need to do for you is actually do something called biofeedback therapy.
Okay.
We need to, even though if you have a cat or a kid or something bump into you,
Oh
I'm
yeah.
sure it sends you to the moon. So
Yep.
See, I told you I wasn't crazy.
no, you're not crazy. So if we can get you, I know it's nice to actually have somebody talking to you, huh?
I feel so crazy all the time. People
No.
tell me you're just fat.
No.
And
You're
I
not
don't
crazy.
eat hardly anything.
No, this is all genetics and inflammation.
I have ate healthy all my life because my mother had cancer. And we weren't allowed to fry foods. We baked, broil, and put on the grill, and we never fried food.
Yeah. No, I wish that I could take all the people I've seen that have had your condition and have seen them years ago, because the biggest issue we're dealing with a couple different things, but you're not only are you dealing with your pain and the way you see your body, but then
I
honestly,
actually ate myself.
and you shouldn't, because it's not your fault.
I really ate myself a lot.
It took a lot of her dependence away from her.
Yeah.
I
Well,
can't even get my shower.
Yeah. And what we want to do is we want to get that independence back, and we want to do it. It's
I'm
not
so
gonna.
sorry.
You're fine. No, don't worry about it at all. I completely understand and get it, and that's why you're here. You're here to talk about it honestly and get the help you need.
Thank you.
And that's fine. Like I said before, here's more tissue.
Thank you.
We can have breakdowns. We can have frustrations. I've had people that have yelled at their parents. All sorts of stuff because there's.
I wish my daddy could hear you right
Well,
now.
if you want me to, I have no problem going out and talking to him.
Yes,
and telling
please.
him. In fact, I can bring him in here.
Please, he's in
Yeah.
the lobby.
Yeah, let's go through our plan, and then I'll
Okay.
bring him in and I'll explain what's going
Thank
on.
you.
So then the physical therapist will also help you out with compression wraps, because what we need to do is we need to get the fluid out. We need to get your legs, even though they're large and your arms are large, to what I call a dry weight. We need to try to mobilize that fluid and see what's left with tissue. Okay?
Well, I have a question. Does
Sure.
that help with the hips? Because,
Yeah.
see, my hips just recently started swelling.
Yeah. And so that's where we're going to have to see, right? Because that's why I want to get you the pump that goes up through
Okay.
your belly and your hips.
Okay.
So we'll work on all that.
Okay.
It's going to be a process, but we'll get to everything.
Okay.
And so physical therapy, get you a better pump. There's also a vitamin I want you to try. It's called Vasculera. Okay, I'll write it down. Don't worry about it. You're fine. And I don't think it has any interaction with the MS or anything like that. I'll double check on that.
Okay.
But it is a vitamin supplement that actually is a natural anti-inflammatory,
Okay.
and it's helped out about 3/4 of the people who I tried on with your specific issue.
Okay.
Okay, because what we want to do is we want to decrease the inflammation. It's the inflammation which is causing the pain. It's not just nerve pain that you're dealing with. And I know everyone gets so focused on nerve pain
Yeah.
because it feels like nerve pain,
Mm-hmm.
but it's not. It's inflammation of
And
the
it
tissue.
hurts even down to my bones
Yeah.
sometimes.
So we need to help you out with that. So that's an option that we can do. The other thing we need to take a look of, and this is serious, is we need to either get you to some kind of a true nutritionist,
Okay.
okay, and see what your metabolism is really like.
Okay.
And also talk about if even, and I know people probably talked about this before, would a gastric bypass even be something we should consider? Because just because you get that doesn't mean it's going to help. Does that make sense?
Yes.
Because it can give you a lot of problems. You're not absorbing the nutrients you need and vitamins and everything else. But also your calories aren't matching up with what we're seeing here. So we know we got something else going on. There's some kind of a gene turned on, like with the lipedema gene, that's causing this. So that's why I want to talk with a nutritionist, actually do calorie counts, take a look at everything.
Okay.
Because it could just be that our metabolism is so low because of everything going on with you that even if you're eating just few calories, we're still putting on some weight because our metabolism isn't getting up there.
Right.
And we got to figure that out, okay? And so that will help with stuff. Then what we can do is once we start losing weight and we get the things off and the tenderness starts going down and we do the biofeedback with physical therapy and we get you the better pump and you're able to be more mobile and you get your quality of life back a little bit more. There are things we can do where I have a plastic surgeon that does do lymphatic sparing liposuction and can actually pull some of this out of the arms and out of the legs. It never makes it perfect.
Right.
But we can contour things a little bit so that you can move your thighs easier past.
Yeah, because I want to be able to, my legs actually, the wheelchair is helping, but my legs don't go together like they
Right.
should.
And so all of this is one big package, even though it's lots of different things. And that's how we need to do it. We need to split it up in different things.
Okay.
And everyone is different. So every patient who I see who comes in with similar issues like you is different.
Right.
And so what I think we need to do is again, physical therapy first.
And I
Get you a better
have these
pump.
little weird,
Yeah,
like little lumps in my skin.
yeah. And those are little, so there's a lot of different things that it could be, but most of the time when you're getting these lumps, it's almost like little lipomas or little groups of kind of these fat globule kind of things. And they kind of get in these sacs, and that I'm not as concerned about. I don't think it has anything to do really with like calcium deposits or things. If it gets worse, they get hard, more tender, we can look at that, but I think that's probably what it is.
Okay.
So, really what I want to do for you today is confirm your diagnosis that you have going on. Tell you we're going to help you out. Get some people in your corner, start working on this stuff. And we're going to slowly start nibbling away and try to make improvements. My goal for you is not going to be just in a week or months.
Right.
My goal for you is looking 10, 20 years down the road.
Thank you.
Okay, so I'm looking long term. So it's going to be a long, hard road, and it's going to take a lot of work.
Okay.
The biggest issue I run into with this is you and I can sit down in this room, we can have a great conversation, we can have a lot of ideas, but then getting those ideas to occur is tough because we're out of different health systems, travel, and what we need to do is we need to be consistent. And so when we're consistent, it takes time, it takes money, there's stress involved, there's a lot of moving parts.
I'm willing to do whatever.
Oh, I know, but life happens, right? You know, your dad gets sick or something else happens or whatever it might be. But I just want you to know we're going to stay on. Sometimes we fall off the bandwagon.
Right.
But we'll hop back on and we'll keep riding the ship, okay? But it's going to be long. It's going to take a long time.
It didn't happen overnight.
I know it didn't happen overnight, but what's really frustrating is that you saw it slowly happening, and then at periods of time you probably saw this sudden swing. Where all of a sudden it accelerated.
So active.
Yeah.
Even my mom was like, well, she's active. I don't understand. That's why they kept taking me to nutritionists, and all they would ever say, well, eat this portion, and it wasn't like that for me because I really don't get hungry.
Yeah. So my oldest son, who I adopted actually, he had quite a bit of weight on him during pre-adolescence and adolescence. And it turned out a lot of it stemmed from his birth father and stress and anxiety and everything else. And it didn't have anything to do with what he was eating.
Right.
His weight on him was all due to stress and his cortisol levels and everything else. And it's only as a young adult that he's finally started dropping the weight because that stress, even after all that time, has finally started to go down.
I have a question.
Sure.
Could stress have triggered mine?
So I wouldn't say stress triggered your lipedema.
Because
But-
at 4,
Mhm.
my father was, my stepfather, he was murdered. And at the time, I thought he was my real father. So he raised me from 9 until 4. So I started having problems with my mental health. And then at 6, I was raped by the neighborhood kids. So all my life, I've had so much trauma. I'm sorry.
No, I get it.
And I've always wondered, am I different because of this stuff? Or was I not active enough?
Now, so I don't think that those things caused your genes
Okay.
to be put in there at all. But yes, stress can cause things to occur. One of those is weight gain. It could have caused, now, whereas usually adolescence is the trigger for lipedema. Because of those events, maybe it did cause that to get turned on sooner in you than it would have been somebody else. So you would have gotten lipedema no matter what.
Right.
But yeah, I mean, I can't imagine why that couldn't have contributed. Does that make sense?
Yes, sir.
So I don't think it's the absolute cause, but it certainly is a contributor.
Can I pull this down
Please
just
do.
a little bit?
Take it down all the way. It doesn't matter.
The tears are getting on it.
No. I get it.
And I've always been smaller in the neck area.
Mm-hmm.
And I used to be able to see my collarbone, but my body's always been bigger from the waist down. And then probably about 20, I started getting the arms problem. And it's just got worse.
Yeah.
And people look at me funny. I've even had a cashier take a picture of me because I was so big.
I'm so sorry.
I felt like a monster, and I've told him that before. I've been like, I feel like a monster.
You're not. You're not. These are uneducated people who are very selfish and only look for their own personal gratification, with no mind of what's going on in the life of the individual that they're seeing. And I can't stand it. And it's because of people like you that I started this clinic.
Thank you. Thank you.
I'm sorry you're going through this, but you're not alone. And you have people who know what's going on with you and your body and will help you out. You're not alone.
I appreciate that. I have felt alone for a long time.
Yeah.
And I was just scared that I was just going to keep getting bigger. I even tell him all the time,
Yeah.
I don't want to get any bigger because I don't want to die in my house by being big. And them just saying, well, it's because she ate so much and I never eat.
No. No. Let's get this figured out. Okay? Slow baby steps. Don't put too much on yourself that needs to get done immediately. Slowly we're going to make it better.
My only issue is balance from the MS. My legs being balanced.
But,
And the weight has just made it so much worse in the pain.
but you know, who knows how much of because of your because a lot of what you're going through here is, let's just say, auto-inflammatory. Okay? And MS and everything else is like these autoimmune disorders. So with all the stress you've been through, it doesn't surprise me that you have had your body in a way kind of attack itself. That makes perfect sense.
It does.
Makes perfect sense.
I stay stressed out now.
Yeah.
So yeah, I'm pretty sure my body's like, stop it.
Yeah, but no, we'll help you.
Thank you.
Okay.
Thank you. That means a lot. Because I didn't want to lose him. We just got married and
I know.
he's been perfect.
I know. So my wife has a lot of health issues. She feels the same way. Before we got married, she said run the other way.
That's what I
Okay.
She still tries to get me to run the other way.
Yeah, my wife still says it every now and then. In fact, she gets angry with me. I told you not to.
No.
Now you can deal with it. You know,
It sounds about the same.
you know, but I get it. I understand. We'll help you out.
Thank you.
Okay, at the very, very least. Okay, this is if we're making minimal improvement with stuff. We're going to work hard. You'll have people that understand your diagnosis, what's going on, and you'll have a good sounding board.
Okay. Thank you.
Okay?
I'm excited. I'm ready to start.
All right. So what's your dad's name?
Donald Bicknell.
Donald?
Mm-hmm.
Okay. Let me go get Donald. Is he with anybody else?
Yes, his wife.
Okay. Do you want them both in here?
If you don't mind.
Sure.
Because she's picked on me my whole time too.
Okay. So I'm just going to talk to them about the education.
Okay.
I'm not going to present it as if this is something that they're to blame. I'm not going to get into that. I just want to tell them what's going on, what the diagnosis is, if you don't mind.
And you've looked at my pictures
Right.
from childhood.
Yep,
So.
yep.
Okay.
And I'm going to explain what caused all this, and then what we're going to do to try to help you out. Okay? All right.
They should be right into waiting.
All right. So it's Donald and
Barbara.
Barbara. Okay.
Oh, you told on your daddy.
Is that still running?
Uh-huh.
Okay. I might have to cut some things out, but finally. I told you. I told everybody.
You did.
All right. You know these people here?
Yes.
All right. Very
Slide that down a
good.
little bit so we can move
All
this.
right.
I'm fine.
Yeah, please, there's a stool right behind you. Have a seat. Just watch your head. There's a keyboard behind you here. So, I don't know what you've been told in the past with your dog and everything else. I wish I had seen her when she was 12, because I think we could have helped her out a little bit more. The issue is she has something called lipedema. Lipedema is also known as painful fat syndrome. It's a genetic condition that she was born with. Usually gets turned on around adolescence or so. I think hers, just through everything going on with her life, got turned on maybe a little